Okay, this is also a continuation of the other question. It says rest is the best form for treating orthopedic conditions.
Rest.
No.
Okay.
Okay, so we
What
usually
kind of orthopedic condition?
yes,
We have a lot.
yes, we usually ask for rest if it's an acute condition. So when
Okay.
I mean acute, it means you just had the problem, it just started.
Okay.
Acute, that's 2 weeks. So you just had trauma. Okay, so we ask rest, elevate, rest the knee, elevate, so that it can heal. So another form of rest we usually do is to put a cast just so that those structures could rest and heal. We could use splints, braces, so that it could heal. You understand?
Okay.
So in the acute phase, rest is encouraged. However, when we pass the active phase, you see us refer to physiotherapy because then it is time to do what? Move. So there's a place for rest and then there's a place to move.
Excellent. Thank you, ma. So the next question on our list is
Okay, so this one says only older adults and athletes need orthopedic care.
why those ones?
I don't understand. So there are diverse orthopedic conditions
Okay.
that need orthopedic care. That's clubfoot, all right? That's a baby. Bring to the hospital. There are congenital conditions that need, congenital means the child was born with it, that needs orthopedic care. All right. Children also have injuries. Bring them for care, please. Adults do have injuries. So it's not just those classes of people, okay? Everybody needs orthopedic. If there's trauma, I mean, newborns have fractures and they've had orthopedic care and they are fine now.
But I've heard people saying, in the midst of young people that this back pain, waist pain is not for, that you're too young to have this, you're not exercising enough, please hit the gym, do this, do the other one. They believe that young people shouldn't have, in fact, they shouldn't have to go and visit the orthopedics. Do you get? That's why you see some of them, it seems they just believe that it's just meant for papa and mama to go and see to seek for orthopedic care.
Okay.
So young people should also be encouraged when they have orthopedic conditions.
Like I said, there are different orthopedic conditions.
Yes.
If I mention now, you'll be confused. So let me just keep the names to myself. So when we have a young person sit and describe, we already know what condition we are talking about. Do you understand?
Yes.
Because that young person falls into that category of exactly. We see, okay, so let me say this about the gym. So I've seen young people go and they carry weight. They carry weight for, I don't know why they are doing that. And then they come with sudden back pain, spasms, So when a young person has back pain, okay, we really shouldn't have back pain in a young person, but if there's back pain in a young, it's a red flag. Yeah, it's a red flag. Back pain should be just for the reasons I've explained, because of the degenerative nature of back pain.
Yes.
It should be more common in people that have lived their lives.
Yes.
You understand what I mean? So usually when we see back pain in a young person, it's a red flag. So we tend to ask, and majority of the times it's exercise.
From the gym.
Exercise. Now, gym is good, please. Don't. Gym is good, but don't overdo it. Do not. We are all built differently. Believe me, we are all built differently. Because A can carry a 120 kg. Does not mean
don't go and
you should carry 120 kg.
That reminds me, Ma, we also have in physiotherapy, we also have what we call exercise screening.
Exactly.
I don't know whether we do that in our gyms.
I don't know.
So we encourage people also get physiotherapists involved in your gym.
Yeah.
Because we are expert in those exercises. We are not coming to take over the work of the exercise instructor. No. Far be it. But what we are going to bring professionalism. We have what we call exercise screening. We have what we call exercise prescription. It's not the exercise you're supposed to give an arthritis patient or maybe give an older person. You just go and use it and give to a younger person.
Exactly.
So it has to be well prescribed. And then we also have what we call exercise monitoring. Exercise has to be monitored.
Yeah.
There are sometimes you'll be exercising, and there are some signs that is coming up. If it's well monitored, That reminds me, there was a time, sometime in the past, when I went to a nearby gym. Gym is good. We are not here to speak about, speak
Please
against it.
exercise. Hit the
Exercise
gym,
is
please.
very important.
Yeah.
So I went there. The young man was exercising. He was exercising so rigorously. At a point, he started bleeding from the nose and from the mouth. I was discussing with somebody just outside the gym. So I noticed that he was on the treadmill. He was walking on the treadmill. So I have to excuse myself. I went to him. Oh, sir, please, can you slow down? Because something is happening. And he was alone. Nobody was monitoring. Can you slow down? Something is happening. Maybe you can just rest. You have done enough for
Yes.
today. Maybe some other time you can continue. Do you know, the man ignored me. He just went for a bottle of water, put it inside his mouth, he spit out, drank some, and went back.
You must burn it, tone the muscle.
I felt so bad because I wanted to save life. I wanted to help him out to educate, but he ignored me. So I have to went and continue with my business, what I was discussing. Because, so what we are trying to say is that exercise is very good, but it has to be well. It can also be dangerous if it's not well, you don't embark in it in the right way. We have written a lot of contents on that in our channel, so you can also avail yourself the opportunity. So thank you so much for that.
Yeah.
So the next question on our list is,
Okay, so this one says, is it true that having bone fixators makes one prone to electrocution?
Okay, so we deal with lots of hardwares in orthopedics.
yes,
Lots and lots of hardwares. Okay, so so the X-fix, okay, it's what is the external, okay, so it's what hangs out after we fixed in the bone, so it's found on the skin. No, it doesn't make you prone to electrocution. Okay, we use that because there is an open wound, so we cannot put what we call the implant. Okay, we can't do an internal fixation because there's an open wound. If we do that, there'll be infection and the bone will be infected. And what we dread is bone infection. We dread it. Okay, so it does not cause electrocution. The only thing is there's just a little disadvantage. People will keep looking at you, and then if you go to the bank, it will keep beeping. That beep beep, but no electrocution.
okay, all right, thank you.